So first of all, being how do we cope in challenging times, challenging inside and outside of midwifery? As Sue said, I'm a panelist in the Nursing and Midwifery Council, and the types of cases we see coming through often involve maladaptive coping strategies where people are using alcohol and other substances to cope. And of all the Nursing Midwifery Council fitness to practice cases, this is between 2014 and 2016, 16% related to alcohol and 10% related to drug use. So this is something we see quite frequently come up. I've had experience of it in practice, and also doing this research, people have come forward to me and told me their stories about how either themselves or their colleagues have struggled in practice with this. But if you look at the literature, it's largely dominated by experiences of care of physicians and nurses on this. As usual, midwives are lumped in with nurses, and we're not really looked at as an individual professional and how this might affect us. And the common findings we see in outside literature is really related to a lack of support, fear, stigma related to this, denial, unhealthy coping strategies, not knowing how to cope, obviously mental ill health associated with this, and the need for targeted workplace wellbeing interventions, and the stigmatizing perceptions that substance use is a personal choice or a failure or moral character, etc., which act as barriers to help seeking and aren't really helpful in themselves or true. And like I said, the data on midwives and nurses is often merged, but it has been looked at before in other professions. So first of all, when we started on this journey, in 2020, we did our own systematic review thinking about, well, what is out there on midwives? You know, if we're looking at the topic altogether, we only found 3 studies after doing a systematic review on this. So it really is limited. And the overarching things we saw were, yes, there was in relation to midwives, harmful daily drinking, and that was linked to working hours and harmful alcohol consumption, but it wasn't really looking at many other areas of substance use at all. And then in terms of student midwives, it was about escape avoidance, and then there was alcohol, tobacco and cannabis use. But the stuff on the student midwives was kind of related to student culture. You know, it's, you know, £5 night down the local pub in the student union. And so that binge drinking culture comes in with studenthood in general, rather than it being about linked to the profession. So we knew then that there really wasn't anything on this, but it was a real problem that was being highlighted by fitness to practice cases. So we decided to do some research on this, but there was a real ethical dilemma in doing so, as in I can't really say, hey, midwives, if you're experiencing problematic substance use, come and talk to me, because there's fitness to practice issues related with that, and I would have to refer them to the Nursing Midwifery Counsellors and fellow registered midwife. So we really needed anonymity and confidentiality to get people to talk about this and seek help. Impairment poses risks. We needed an amnesty to say, you know, if you come forward, you know, there's no consequences to you talking about this, because it's better that we know what the problems are and what we need to look at. So we decided we needed to move forward with this. No punitive actions, confidentiality, anonymity, you know, was the greatest benefit for all to do this research. So we published our ethical decision making in a paper there that we argued that this was needing to be done. So in 2020 we did our first study on this, and thank you to everybody who took part. We aim to capture self-reported occurrences of problematic substance use in midwives of the UK, and also what stopped them from seeking help, and what they thought about impaired midwives, either themselves or other people. So we had 623 NMC registered midwives surveyed anonymously, and we used the TAPS tool and the Perceptions of Nursing Impairment Inventory to as our measurements. So we changed nursing to midwifery. And our data collection was January 2020, and we had to stop it early because in March 2020 the lockdowns came in, and we thought, you know, with lockdown things are going to change quite dramatically, and we felt that might impede our data collection. So we stopped in March early, but we still got 623 midwives captured, taking forward, and we published our work in occupational medicine, and that's now published and ready to read if you want to look at the full findings. But our brief overview of findings was that just over a quarter of the sample screened positive for problematic substance use, and that was in relation to alcohol and a range of restricted drugs. It occurred reportedly in response to work-related stress, anxiety, bullying, traumatic clinical incidents, and the maintenance of overall functioning. So somebody taking too many sleeping tablets to recover from a night shift, etc. And 11% of those affected said they had sought help. 27% said they should seek help but did not, which is quite worrying. And the barriers to them seeking help included a fear of repercussions, shame, stigma, practicalities, and a perceived lack of support either available or they thought they didn't need it. And 10% of the sample said that they'd attended work under the influence of alcohol, and 6% under the influence of drugs other than tobacco or those prescribed to them. And 37% indicated concern about a colleague's substance use, so not themselves, but their colleagues. And the most perceptions on impairment were compassionate, which was really refreshing to see that people were very compassionate to other midwives in this situation. But there were a minority of really stigmatizing attitudes displayed, which is disappointing. And so the reasons for use, this is just a few of the reasons people said. Midwives said they were trying to cope. Social stigma means I have to walk around my block late at night and I fear for my safety. Cannabis helps me relax. Following traumatic incident at work, I started using weed and booze to cope. Work is hard, it triggers my anxiety, I feel trapped. Escape from work stress, taking cannabis and cocaine. Bullying and blame culture in midwifery is rife. I use coke and dexamethasone to cope with hours of lack of sleep and having to function at work. So this is really heartbreaking, really. In terms of concern for colleagues, coping, midwives come on the early shift after heavy drinking the night before, shaking and impaired, trying to get through the shift. Colleagues addicted to alcohol, named and shamed by colleagues rather than helped and supported. They're bullied. Everyone else is looking on and learn from that. Now nobody asks for help, it's dangerous. So there's something there about if you see someone else treated poorly, you're less likely to seek help yourself. And midwives take cocaine to get through shifts. So this is kind of what was happening unspoken in practice. And then why help wasn't sought when needed. People said they felt trapped, they needed help, but if they sought help, they'd lose their registration or they'd lose their job. So they really felt like there was nowhere to go. I've seen others named and shamed rather than helped when they reach out for support. I can't afford to lose my job, my professional reputation. I struggle on. And then someone else, rather than helping her, she got sacked, named and shamed. It sends a very powerful message to others. If we need help, we get destroyed. No wonder we soldier on in silence. So this was the stuff that was going on that wasn't being resolved. And it was largely because of these stigmatizing attitudes that came through, where one midwife said, there's never an excuse. Midwives impaired by substances should be named and shamed, struck off and kept a low profile. We're a proud profession. As a senior midwife, I believe there's no room for weakness. One colleague was stealing drugs from work. She was suspended, and I made sure I told as many people as possible about it, including local and national newspapers. So that's really quite shocking there. And in my experience, midwives who've misused substances always play the mental health card once they've been found out. It's just an excuse for their own mistakes in most cases. So you can see why some people wouldn't seek help if they were faced with these attitudes in practice. But there were some majority compassionate attitudes, which is really refreshing. I believe abuse of alcohol is high. As nurses and midwives, there was no specific treatment programs aimed at them, unlike doctors and dentists who have, and they did not have to pay for. I applaud what you're doing. I'm really pleased that this kind of research is being carried out. There's far too much social stigma for midwives to feel empowered enough to address their issues / ask for help. So that's really encouraging there. And if we go on to surviving then, after that first study we did, we had obviously COVID and a number of lockdowns and a number of really stressful months, years of practice where things did change and everyone was put under pressure. And in the wider literature, people were talking about how health professionals might be surviving during this time by exacerbated substance use. People thought it would have increased in healthcare professionals during the pandemic. And the COVID pandemic has depleted frontline workers, where we know they do sometimes turn to maladaptive coping strategies in order to cope. So we thought, right, we need to do another study. We need to follow up our 2020 study with a 2021 study. And this was funded by the Ireland Trust. So very much grateful to them, very thankful for them. for helping us to do this study and funding us. So 1 year on from the COVID-19 lockdown, the first lockdown, our aims were to identify the rate of problematic substance use again, to explore leaving intentions. So I know that this has been done why a midwife leaves. That study was done a few years ago. So we wanted an update on that following COVID. We wanted to explore the help-seeking behaviours of midwives. Are they more or less likely to seek help following COVID? And to identify the health risks and the work engagement of midwives. So how are they surviving? How are they coping following that lockdown period? So we plan to compare our data to those collected in 2021. And again, like I said, the Untitled Trust funded our study recruitment, so we were able to reach more people, although lots of people had survey fatigue, unfortunately. They still do. I do understand that. But they were able to give me media training as well, because I thought that the media would be highly interested in this, and I didn't want the media to take this down a road it shouldn't have gone down. I wanted the media to kind of look compassionately upon our results. And they funded the dissemination events, and they helped us bolster future plans because we were able to talk to more people about where they wanted this research to go. So these are a pre and post COVID kind of initial data. We haven't published these yet, but these are our early findings. And you can see in the first column, pre-COVID, the level of PSU, problematic substance use, and then post-COVID, it went up in every single category to the point where in terms of alcohol, that 8.68 odds ratio, it means it's 8 times more likely to be identified this time round than last time round. Bearing in mind, it's not the exact same people who are participating this time. There would have been some people participating in both the first and second times round, but really it was just from the same pool of people. So we can't talk about anything in terms of prevalence or anything like that, but we know that it's more likely to be identified post-COVID than before. So here's some more quotes from the second survey we did. They are named and shamed in newspapers, shunned by colleagues. One person I know who was very ill and using drugs was sacked. An ex-colleague still tried to bring her down years later. I tried to reach out to colleagues, but I was simply marched off the premises and treated like scum. They literally spat at me as I left and looked with disdain. They called me a substance abuser, which I found hurtful and unhelpful. I'm not an abuser, I am ill. And that's definitely how the NMC treat this issue, which is really refreshing to see. I used to have maybe a bottle of wine a week. Now I can easily have 3 or 4. Definitely after a long day, I want wine. I wish I didn't feel like this, but I'm feeling tired, burnt out and unappreciated at work. I love my job, but now how the pressures of it make me feel. My family have noticed that I am moody and stressed, and I think I drink more often than I used to. And this is, again, I can't seek help as a registered professional. I am stealing and using drugs. I would lose my job, reputation and everything. So that the same issues were coming up, really. I've investigated midwives who indulge in substance abuse. They betray us all by stealing. They are drug abusers. There's no excuse. That's a stigmatizing perception there. And then I think about leaving, but I don't know what else I would do. I loved the job when things were good. So slight change there. And then in terms of people being likely to leave the midwifery profession, these were some of the reasons they said, and this is our early analysis. We've got more analysis to do, but the main reasons were retirement. We know there's lots of people about to retire from the profession. Really high rates of too much pressure. It's stressful. I've got poor mental health due to my job. Toxic work environment. So that's not just bullying, but people describing the workplace as being toxic, psychologically unsafe. There's a lack of career progression opportunities, lack of support. People's personal circumstances change, so they have caring responsibilities, etc. Major dissatisfaction with the quality and or type of care people were able to provide, so not being able to be the midwife you want to be, a recurrent theme there. Some people left the profession to get help for their substance use because they didn't feel they could get help and stay in the profession, which is quite sad. Dissatisfaction with staffing levels, the reason they're leaving, planned career change, lack of flexibility, perceived preservation of physical health. So if I don't leave, my back, I need to leave because my back problem will only get worse if I stay, that kind of thing. bullying, a feeling undervalued, and a lack of job satisfaction, which kind of ties in with the quality and or type of care able to provide. So like I say, these are our early kind of thinking in terms of the themes coming through, but we want to do more analysis there. And then people said, being a midwife is who I am, but I need to look elsewhere because the profession is destroying me. So they're leaving for those reasons. This is not a healthy profession to be in, not unless your face fits. Midwifery in itself is changing, feels like it's putting out fires rather than having time to truly care. And then someone said, I'm addicted to drugs. That's not compatible with an MC registration. I see no way I can get help without getting out the profession altogether. Now, that's really sad because we definitely have cases at the NMC where people have managed to get better and have managed to recover their fitness to practice and their ill health following situations like this. So I'd really like to do more work there in terms of people understanding that the NMC is really there to help. So let's talk about thriving, the last part of this this presentation. I didn't want to leave with kind of doom and gloom. I wanted to say, okay, so what can we do in order to improve things? What can we do about this? So be kind, obviously, is a big thing. Understand that we need to support each other and be kind to each other. And I also, with my esteemed colleagues last month in the Lancet wrote an article about midwives need a usable past to shape their future. There's recently been challenges to our standing as midwives through reports, set reports, and in the media all the time, really. And I said in the Lancet, conventionally, professions are granted autonomy and social recognition for the services they provide, but midwifery often lacks such status, which impedes our success. We're not respected in society, so that impedes us doing what we're really able to do. And I kind of made an analogy. You wouldn't tell a hairdresser that they didn't know how to cut hair. We're midwives, we know birth. We are the experts in that area and need respect for that. And a poorly articulated professional identity might have negative consequences and impact upon the recruitment and retention of midwives because it's a determinant of our job satisfaction and sustainability of practice. So we really need that professional identity to be articulated well and shape who we are. And it's just recently been the year of the nurse and the midwife, again, lumped together, nursing and midwifery. And it was on the centenary birthday of Florence Nightingale. So where's our kind of midwife hero, in our past? Where's our past shaping our future? And for midwives to be fully valued and play a crucial role in reducing global and maternal and neonatal deaths, their professional identity must be firmly instantiated. So that's definitely where we're going next with our research, thinking about how do we instantiate our own professional identity, put a stamp on who we are, and get society to mirror back that reciprocity in terms of valuing who we are, so that we feel less likely like we want to leave the profession, more like we want to stay and do our best and have that value firmly there. Also, myself and Dr. Karen Mayer, who's an occupational psychologist, and she specialises in midwifery, which is really cool. And we're writing a book at the moment, and we are drawing in lots of different authors, lots of different perspectives on this, so we can help people to unearth their own identity as a midwife, who they are, occupational psychology tips on how to survive and thrive during the day-to-day challenges, respond to workplace challenges, and Karen was involved in all of this research throughout, and she's really been it's really been great to have that other perspective outside of midwifery to look at this, because she's helped us to write all these chapters on thriving in interpersonal relationships, surviving when things go wrong, surviving in evidence-based practice, and then there's stuff on leading with impact and turning your visions into practice. So it's a bit of a kind of self-help, surviving and thriving in midwifery, which we hope to have out next year. So that's something we're really putting all the research together and everything together to say, okay, now what can we do about this? And this is just another kind of off the cuff thing that I'm putting out there. I have a PhD studentship opportunity out at the moment. So again, we can survive and thrive in evidence-based practice. And this is linking evidence to our teaching. So if anyone's interested in doing a PhD and trying to think about how we put our research and our evidence base into our educational teaching throughout our careers and within student midwives, there's that opportunity there. And then lastly, Midwives in Focus. We've brought together, I'm the project lead for Midwives in Focus, where we're really looking at how do we pull together midwives around the world. And we're doing this in partnership with JPIGO and Coventry University, but we're pulling in other stakeholders as well as we go. And you can see the steering committee there, to think about how do we pull everything together? How do we make sense of things? And doing that initial data check and data collection on professional identity. So, you know, if you're a midwife or a nurse midwife, how does that affect your professional identity? And then everyone's talking about, you know, strong midwifery leadership. That's what we need. That's what all the kind of reports are saying. Well, what does that look like? What does that mean? How do you know a leader is strong? How do you know that leadership is the best it can be? And how do you emulate it? And then we're also looking at representations of midwives around the world. So how do we want to be instantiated? How do we want to be represented? Who is our historical hero that we can have our own Florence Nightingale type character that we can hook our own professional identity onto and move away from being lumped in with nurses and really standing out on our own? So that's the work we're doing there. So there's lots going on. And I try to share as much as I can on social media and our blogs and everything. But as a last kind of thank you and goodbye, everything, could I ask that you complete our survey, which is a global call for all midwives and nurse midwives, to share their ideas and experiences on their professional identity, strong midwifery leadership, and the representation of midwives around the world. And the link is there, and the QR code is there as well. Share this with all your colleagues if you have, especially if you have international midwifery connections, because we'd like to get as many people as possible to across the world to think about this and get our first data collection on this, so that we can take forward the work we want to do in terms of instantiating midwives and their professional identity, so that all of the things we're talking about, surviving and thriving and maladaptive coping, we can take forward in a positive way, and do something productive with that, and move forward towards actually instantiating midwives as they need to be.